Okay, so we're going to talk about what's new, hot, and important in veterinary behavior and behavioral medicine literature. And my first topic is going to be drugs, drugs, and more drugs. Okay, now I know two things, that this is a blitzkrieg approach to the literature and it's not really random, and I'm picking things that I think the audience will be interested in and that I think you need to know. But I also know that not everybody who's listening is a veterinarian. So I'm going to get the heavy lifting with the drug topic out of the way, and I'm going to cover a series of papers that I think are important, one set of them because of the controversy they've generated, and the rest of the papers because they're either new drugs, new applications, or new data on usage, which should make people feel very comfortable about using these. So let me take on the first topic, which is the controversy. Okay, this is a paper that recently appeared. In fact, it's in the current issue of the Journal of Veterinary Behavior. Full disclosure, I'm the editor of the journal. And it uses fluoxetine at a dosage of 2 to 4 milligrams per kilo every day for dogs who exhibit this hypersensitivity, hyperactivity syndrome using the French diagnostic school. Now, let me just say something starting out, because this is outside the dosage range of Reconcile, the licensed product. And that package dosage range says 1 to 2 milligrams per kilo. And people are usually starting in the 1 milligram and maybe 1.5. And the suggestion is you could go up to 2. Okay, now let me point out to you what happened in this study and why this has generated some controversy. Of the 89 dogs that had this HSHA syndrome that they talk about, which is a dog who can't stop moving, who has an insatiable appetite, and a dog who doesn't sleep well, uninterrupted sleep at night. And for that diagnosis to be met, all 3 of those conditions have to be met in this terminological school. 41 out of 89 dogs had an adverse event. That is high. Now, 39 of 89 dogs were not affected by any of the 5 studied adverse events. They looked specifically at 5 adverse events. 9 of the 89 were severely affected. That's 10%. You're up in a range of 10% for severe effects. You're going to have trouble licensing this drug. Okay. And then you had about half of them have some kind of adverse event. So we're going to talk about what they found for these. And they have a way of adjusting the scores for this that I'm not going to take the time to explain, but I want to point out the data. I also want to say something else about the adverse events and how they could have affected their outcomes, because they address it and they do a good job of it. So if part of the problem is that you're not sleeping well, if we give you a drug that is sedative, you'll sleep, but we don't want a sedative effect in an anti-anxiety agent as the primary effect. We don't even really want it as the secondary effect. A little bit of mild transient sedation, everybody can tolerate, but as I think I've mentioned before, we're now required, if we want to license a drug, to separate out the anti-anxiety from the sedative effects. So really what you don't want is a dog who is truly sedated. So did the dog sleep better because they were sedated? Well, no correlation was found between sleep improvement and sedation. So they slept better, but not because they were sedated, which is a good thing. However, fluoxetine is one of those medications that can cause anorexia in the extreme case. And when I say anorexia to clients, I mean they stop eating. And I tell clients, if they haven't eaten by day 2, stop. This is not the medication for them. They're not going to start. There's another group of dogs that gets fussier and fussier and fussier and much pickier about food. And we might not continue them on this medication. But they did find an association between these ravenous dogs and a lack of appetite. So one of their effects could have been due to the adverse events for which we often change the dose. Okay, now They're using 2 to 4 milligrams per kilo and getting a large number of adverse events, only 10% of which were severe. In a study that came out before this, a couple of years before this, Maggie Chutter, who was then a vet student, went back and looked through the Cornell University records at what dogs were given which medications and what the outcomes were. So here are the broad diagnostic categories: the general category of anxiety versus aggression versus other. So the other was the OCD and the self-mutilation behaviors. The anxiety was reacting to noises, primarily storms when you're left, and generalized anxiety. And the aggression was the impulse control, the fear related, the interdog, territorial, the common ones. They tell you when they look at the percentage of responders to fluoxetine, they give you the positive ones, the neutral ones, and the negative ones. Now, this is a retrospective study and people's memories can be involved in this, but there were not a lot of negative outcomes. And there were also records for this. So there was follow-up when the patients were being treated. And then when you look at the percentages of this, certainly there were negative outcomes for some of the aggressions. And that was pretty much it. In other words, it didn't work. Okay. Now, let's look at the dosages and see what happened. So this is an efficacy study that asked about dosage ranges. When you look at this, you find that if you look at up to 1.49 milligrams per kilo, you've got really huge positive results. So if you stay at about 0.5 to 1.5 milligrams per kilo, you really get positive results, especially compared to the neutral and negative ones. If you look at the percentages, it's actually quite clear. Okay. Now, let's look at this negative category of percentages where it's easiest to look at. If you look at the high dosage range, greater than 2 milligrams per kilo, the other study started at 2 milligrams per kilo. They had negative outcomes. In other words, they didn't get the desired effect 33% of the time. And at 1.5 to 1.99 mg per kg, 33% of the time, that's half the time. So the dosage range they started for the other study, they didn't get an effect across these. Now, this is across diagnoses. It's not within diagnoses. And they also showed that they could improve the effect by adding any of a number of drugs. Now, it's a retrospective study, tiny. This sample size of 1, okay? This isn't really useful. But if you look at the white spots, you can see that the vast majority of anything you added helped. Some things, trazodone and amitriptyline together didn't help one case. Trazodone didn't help one case. Gabapentin, famotidine, clonidine didn't help one case. You can't say anything about these in the small sample sizes, but in the ones where there are large enough sample sizes, either alone at that dosage range of fluoxetine, or with trazodone, or with clonidine, or with maybe gabapentin plus trazodone, the sample sizes were too small to think about anything else, really. Now, here's my concern. We don't actually take a series of diagnoses and treat dogs with a medication like fluoxetine across a range of diagnoses, across a range of dosages, and find an optimal dose. What is generally done in new drug development is you've got some preliminary lab information, you have a dose you think will be too low, a dose you think is approximately correct, and a dose you think will be a little higher and maybe too high. You do your preliminary studies, you end up choosing your dose, you want maximal effects, which clearly was shown in the Chutter study, along with minimum adverse events, and you want minimum adverse events, and you didn't see what caused a minimum in the 2 to 4 mg per kg in the initial study that we talked about. But you did see that well over half of the dogs had adverse events. So that dosage wouldn't be licensed. So if you're looking to optimize without having that continuous data, a response to a medication, especially fluoxetine, the data support going lower and then building your way up. I pay attention to those adverse events because my clients won't tolerate it. Other clients might tolerate it if it's the only way they can get a decent effect. But if you want to read the whole discussion, it's in the editorial, because not everybody has the same goals for their outcomes. And I'm a little concerned because for at least half of our patients who are treated with things like fluoxetine, they come in on very high dosages and the dogs are experiencing adverse events. We have the dose or take them off the drug altogether, and most of them get better. So this is something that I think we've really got to start measuring. And I'd like to thank both the authors of the first paper and the Cornell group for the older paper that shows how complex this can be. Okay, not unbiased here, I'm the fourth author here. Dexmetatamine oral mucosal gel reduces fear and anxiety in dogs during veterinary visits, a randomized, double-blind, placebo-controlled clinical pilot study. This was meant to be a pilot study. It's a relatively small study, only 76 dogs in here. We looked at 2 treatment groups, 125 micrograms per meter squared, 250 micrograms per meter squared, or an equivalent volume of the placebo gel. And this was made into a 1 milligram per gram oral mucosal gel dosed syringe solution. Okay, so we were just looking to see, is it going to make a difference for veterinary visits? And here you see what we've done. We have a low dose, we have a high dose. We think either of these might help. And then we've got an equivalent volume of a placebo gel. And when you use a low versus a high dose and it's in a volume, you correct the volume so that you're delivering the same thing. Okay, so we assessed the ability to perform the exam. And here's our assessment scale. It goes from 1 to 5, excellent. You could do it very easily, or it wasn't possible. You either needed strong resistance and you couldn't do it even with forceful restraint. The dog showed extreme distress and fear, emptying their anal sacs, etc. Or the procedure wasn't actually attempted because the dog's behavior was so forceful, whether it was aggressive or fearful, that we just decided not to go forward. And then the veterinarians did their examination. And during this, these were video recorded exams. There was a 5-point stress scale. We looked at body posture, tail posture, gaze, activity, and vocalization. And you can assign this and you come up with a global score for how distressed the dog is. So when we looked at outcomes and global scores and where we were, if you look at the green bars, when you translate the changes in scores to outcome measures, the dark green is an excellent outcome. The light green is a good outcome. The pale blue is fair. The light blue is poor, and the dark blue is not possible. You couldn't even do the exam. Now, because we're being conservative, we only looked at good outcomes. The fair was considered a failure. Okay, so it was a treatment failure. If you take a look at this, both the low dose and the high dose, so here's an example where 2 dosages work fairly well. The high dose seems to work a little bit better than the placebo, but they're both superior to the placebo. And when you look at that, that's what these stats tell you, that they are both significantly different from each other, and they're both superior to the placebo. And if you combine the doses, you still have that significant effect. You can see the distribution, and you see it was a small study. But then we looked at signs of sedation. And again, it was basically a 5-point scale. If they were alert, they got a 1. They were able to stand and walk and fully responsive. They weren't drowsy. If they were sedated, they got a 5. They were unable to walk, unable to do any of these things. So a 2 would be you're able to walk around, a 3 is drowsy, and you can go through these scales. So when you look at these, we got, as you increase the dose, you got a little bit more sedation, marginal increase over the low dose, not statistically significant, but both of these dosages were more sedative than the placebo. Nobody was sedated. Nobody was sleepy, unable to stand up and walk. They were either in the responsive, they were slow to react, or drowsy. They were slow for certain reactions, but a little reluctant to get up and go anywhere. Okay. So here's a case where people would probably be willing to tolerate a little drowsiness or ataxia if their dogs didn't suffer in a vet exam, and that was certainly the predominant adverse event, no matter which dose you chose, which tells you that the standard dosing would be at 125 micrograms per meter squared, which is what Cilio, the oral transmucosal product in the syringe, comes at. And if you needed to double it, you could. And that was the point of this study, was to say, if we went higher, could you do this? And the answer is yes. Now, Cilio is not yet in Canada, but the reason I'm mentioning this, it's in parts of Europe. So if there are Europeans listening, they will likely have it, but it is coming to Canada in 2022 after the first of the year. So this will be something available to Canadian vets. Okay, pexian is a mepitoin. It's a benzodiazepine analog, and it is licensed where it has a license. In many parts of the world, in the US and Europe. It's available in Europe. It's not yet available in North America. And every time I ask about a release date, I don't get one. But it is licensed for use for relieving anxiety associated with acute noises, fireworks, storms, these types of things. The pexian label says that you must give it 2 full days, twice a day, before the expected event, and that you must give it also on the day of the expected event. So that's a 3-day period you have to medicate the dog. Cilio, the product we just talked about, this one, is just an oral version of dexmetamine, which we sedate dogs with. And you don't have to start giving it 3 days before. In fact, you give it about 20 minutes before you expect a problem. You can give it up to an hour before you expect a problem. It can be repeated 5 times a day. This is twice a day, 2 days before and the day of the expected event. So you must expect an event. So this group, led by Margaret Gruen, asked an important question. Well, what about long-term usage in places where you have continuous storms? And Margaret lives in North Carolina. So this is really common. There's a storm season that starts early in the spring and it goes through to middle to late fall, and will probably get more extreme as the climate continues to accelerate its change. So could you just give this twice a day for a month? So this is a placebo-controlled, randomized, double-blind study, meaning it was done, again, the correct way. Nobody knew, excuse me, who was getting what, and what treatment you got was randomized. So they started with 307 completed pre-screening surveys, and by the time they looked at the inclusion criteria, the medical things that boot you out of studies. I mean, this just gives you an idea of how bad this can get. They had 49 dogs enrolled. 4 dogs were excluded, or sort of their owners removed themselves from the study prior to randomization. They ended up with 45 dogs out of 307 people who completed the pre-screening survey. This is what happens. This is why these studies are so bloody annoying. So they put 30 in the active group and 15 in the placebo group because they didn't really have a choice. So when they look at the drug, which is the red line, versus the placebo group, which is the black line, and it doesn't matter whether it was intention to treat or per protocol, actually sticking rigidly to the determinations by the protocol, you still got a statistically significant difference for most of the weeks. There's overlap in the error bars at week 1 here, and it's close here. And you have very close error bars here. But if you summed it over the first 4 weeks, it does appear that imepitoin pexian could be given twice a day for an entire month, and would really help with the signs of anxiety associated with storms. Now, you need to know that in the original FDA study, which is published, a third of the dogs taking pexian were still sedated a few days later. One has to ask what the effect of that is in long-term treatment. They did look at sedation. They did have a higher sedation rate than you would have with something like Cilio. But honestly, if you're having storms every day and the dog's making himself sick about this, a little bit of sleepiness and sedation is probably doing a lot less damage to their brain than being upset. Okay, in terms of new drugs that are now going to be on the horizon, again, not unbiased, here's my name. Pregabilan. There are no as needed anti-anxiety drugs for cats. And now there is. Pregabilan, which is Lyrica, was tested in a pilot study, and the anxiety that we chose to look at is one that would be familiar with anybody who's taken their cat on vacation. We're going to put the cat in a carrier and we're going to take the cat in the car. A formulation for absolute family hysteria in many cases. So the first step to getting cats to veterinary practices in many parts of the world is to put them in a carrier and putting them in a car. If you live in an urban area, you may be able to carry them to the veterinary practice, but it was smart to look at transportation because there are data from other studies on transportation. So did the same type of thing. And I'm mentioning all of this to you because for those of you who aren't veterinarians, I want you to appreciate what goes into establishing a drug study. For those of you who are veterinarians, I want you to appreciate what goes into establishing a drug study and why we may not have that one piece of information like, would this dose be better than that dose? Well, we didn't actually compare them because this took forever to get done. Phone interview, owner questionnaire, owner training, so they could help us assess the cats. These cats were videotaped and the clients watched the videos and scored them for us. And then there was treatment, there was a washout, then treatment day 2, washout, treatment day 3, end of contact assessment to make sure everybody was okay. So this was a crossover pilot design where everybody got all treatments. Why? Because we had a small sample size by the time we were done, and you use crossover designs when you don't have massive sample sizes. So we had a placebo, a 5 milligram per kilo and a 10 milligram per kilo dose of pregabalin. And these were randomized and blinded, and nobody knew who got what when. Okay, just to give you an idea of the behavioral signs, and an external observer also looked at these. If you, and that was Clara, and if you take a look at this, these are the actual behaviors that clients and Clara looked at. Clients evaluated them on a scale. Clara looked in detail at these behaviors, and here are the definitions of the behaviors, and here are all the behaviors that she evaluated for these cats in the carrier. And because of the small sample size and the crossover effects from a crossover design, we combined the 2 dosages. There were significant effects independently, but it's a small sample. So we combined the 2 dosages, and on the placebo group, only 9% of the cats put in the carrier had a good effect. None had an excellent effect. Notice there's no dark green here. 18% of the cats taking pregabalin had an excellent travel experience, which means their humans had an excellent travel experience, and 45% of them had a really good one. Only 9% had an one. There was no effect for 14%, and 14% were worse. Nobody was worse in the placebo group, but if you combine these, they come up to 90% of the cats did badly in the car, which we already knew. Okay, and now if you look at the change from baseline in the scores that the owner calculated from their scoring sheet, which they were trained to use, you got a bigger change in decreasing scores for placing the cat into the carrier and for taking the cat somewhere, when you were using the Pregabilan. So there are now a series of other studies on Pregabilan. This is clearly a medication that has a real use in cats. It's got a wonderful safety profile and a great efficacy profile. In this study, we used the actual Lyrica, and I can tell you the cats hated the taste. In other studies, we formulated a cat version, and they were happy with that. Okay. For the rest of the talk, I'm going to talk about 5 other topics, and I'm going to go relatively quickly, but I'll tell you about a couple of hot things you should think about. Muzzle use. This is a study on muzzle use and its effect on dogs out of a lab in Vienna that does just excellent work. And they looked at, this is the number of dogs they screened. They screened over 1,400 dogs. It was an online survey, and they asked people, how often do you use muzzles? A 6 was an always and a 1 was a never. Now you need to know this is a European study, and in Europe, in many places, you can take your dogs on public transport into public squares, into stores, and in some countries into restaurants if they are well behaved and they are wearing a muzzle. There are various rules in various countries, but it's not uncommon in some European cities to see dogs walking around with a muzzle hanging from their collar. And if they go to get on a tram, the muzzle comes up over their nose. And you'll see that if you look at the score, 2 is seldom, 3 is sometimes. So people came in the seldom sometimes for most of these things. Veterinary exam still came in seldom sometimes, but big, big error bars. Public transport, you're up at a 5. Okay, so there's the real reason people are using muzzles, because they can take their dogs with. And when they looked at what the dogs did when they were fastening the muzzle on their face or wearing it, and what types of muzzle introduction they used, in other words, what instructions were you given? Were you given the instructions to put it on the dog's face and leave it there, or were you taught to gradually introduce it? And did you use food treats to gradually introduce it? And did you put food in the muzzle? So the ideal way, if I'm going to teach a dog to wear a muzzle, and I don't very often, but if I'm going to, is I teach them to gradually, using different types of foods they love, to tolerate all aspects of the muzzle, the feel around their face, the sound of the muzzle, the way the strap would feel. And only when they're really, really, really comfortable with all of that, do I slip the muzzle over their whole face with food in the front of it that I know they'll eat, and then start to buckle it. And they've really got to get used to that before they use it. Well, they found out that, no surprise, dogs passively avoid the muzzle, freezes, or get stiff if the muzzle was just slapped on them and they weren't gradually adjusted to it and you didn't use food. And they actively avoid, when wearing it, pawed it, rub their face, they're unsettled, they pant, they bark, or they whine, they growl, if you just slapped it on them. And they, how often from 10 times of fastening or wearing it, do they seem to be uncomfortable, or do they not put their snout in it? Again, if you just slapped it on them, that's common. And they won't put their snout in the muzzle significantly more often if you didn't put food there. So you can reward the dogs for doing this and you get good effects. The other thing that they did was they asked clients what they thought about muzzles. And clients, and I want you to pay attention to this, and the reason I'm covering this is I was just asked a few weeks ago about, should every dog wear a muzzle? And there has been a movement in the United States and now in Canada where every dog should learn to wear a muzzle. I need to tell you, I don't let people muzzle my dogs. Most of the time, people fit muzzles poorly. We just discussed that. They don't accommodate dogs to them. They're using them because they don't want to use humane techniques like we talked about in the first 2 lectures of this series, or they think that takes too much time, and they're going to restrain them and do something they hate. And I really don't want people to do that to my dogs if we can help it. I'd rather use chemical restraint, actually, because then they don't have a bad memory of it, and then they're not afraid and they don't become aggressive. But they looked at disadvantages and advantages. And interestingly enough, more people thought that their dogs, it was a disadvantage with other dogs. I would agree with that. It's a disadvantage with familiar people. With unfamiliar people, sort of neutral. Children, favored a little bit. This is percentages, so there are no statistics here. Visits to the vet. Yes, this is a place where people thought that their dogs were more comfortable. And the other thing that they looked at was access to food or garbage. So some people are using these because they have counter surfers or they don't put away their garbage. That puppy, that computer cannibal, is also a counter surfer. And when he grows up, he's going to be. But we have those already, and we learn to put things away. So there are other ways than muzzles for doing this. And that was their main finding, is that it's vets' offices, counter surfing, and public transport, basically, that are the reasons that people are using muzzles. And finally, they asked people, what fit are you using on your muzzle? Now, I'm going to give everybody a minute or two to look at these. There are 6 fits here. And I would just be entertained to know what fit you think is correct. Because I just showed you the answer. It's this one. It's A. This one that looks boxy and loose and bulky. And notice there's space for the nose, there's space for the chin, they can open their mouth, the strap is in the right place, it's not smacking this against the neck like this is. So this is the right fit. Now, let me say a few things about alternatives. My dogs don't wear muzzles, but all my dogs learn to wear a head collar. The head collars that can close their mouth and be as effective to stop biting and turn their direction and work in vets visits, if someone is controlling the lead who knows what they're doing, are the Gentle Leader and the Black Dog Gear training halter. My dogs now all wear Black Dog Gear training halters, and Atlantic Veterinary College is about to become a distributor of these. They can open their mouth. Notice there's a slip lead here. This is 2 concentric straps so that it's like, leading a horse. Whichever way you pull, they turn their head and they go, they'll self-correct. Lots of advantages. These extra slip straps give them lots of extra choices. And this is just to show you, I'm trying to open Picasso's mouth and I can't hear because it's pulled shut, and he's not the least bit upset. If you need a well-designed muzzle, the Cruise Extreme Buster muzzle is inexpensive. It's got great plastic. It's washable. The plastic will not hurt a human if it hits it. It's got a wonderful center strap. It's got beautiful padding on the inside. It's adjustable in a number of places. Is this muzzle fitted correctly? This is the ad. This is the ad on Amazon. Is this muzzle fitted correctly? No. Look, everything's wrong. This muzzle's too small. He doesn't have enough space between here, the top and the bottom. He doesn't have loose space in the bottom to open his mouth. It's shoved up against its nose. So you can buy the best muzzle in the world, and if you don't fit it correctly, the dog's going to hate it. Okay. So let's move on and talk about some other things. We've talked a little bit about relinquishment in the past, and I want to talk about what happens when people don't think about their pets and what they're going to do when there are problems. So topic 3 and 4 about relinquishment. And topic 3 is about what people think about with dogs when they get them, and does it matter? Now, this is a paper from Anthrozoos, which is not a journal everybody will read. And it's about sociocognitive processes before dog acquisition associated with future relationship satisfaction of dog owners and canine behavior problems. And I know this sounds like jargon, and it is, but this is evaluating how people think about decisions they make. So they've got a 2-phase model of the owner-dog relationship in this study. So early in the motivational phase at T0, before you have the dog, until you've had the dog a few months, you're preparing activities. There are social cognitive factors involved in decision making. You will have prepped for the dog, maybe you'll have thought about this. You get the dog. And then you have an experiential phase where you have to think about, are you happy, or does the dog have problems? Do you have problems, et cetera, et cetera. And after a bunch of very complicated analyses of the way humans think, they came to a couple of important points. The sociocognitive factors assessed in the motivational phase. This is before you get the dog. there's something called self-efficacy. And what is self-efficacy? It's the perceived behavioral control you're going to have. The perceived behavioral control you have over your decision, over deciding what you want, what fits into your lifestyle, etc. Only that was a robust predictor of desired and undesired consequences in the experience phase. And the sociocognitive factors still only explained up to 13% of the variance. So this wasn't the whole thing. But if you didn't think this through and you didn't plan in advance, you had a high probability of future undesirable situations with your dog, and you had more behavior problems, and you were more likely to relinquish the dog. And they said, look, it's only 13% of the variance, but if we can save dogs' lives just by telling people to think of this in advance, it makes a difference. So in this psychological longitudinal design, they were able to see that self-efficacy was related to the experience phase and how you felt about it. Preparing by reading books about dogs and talking to people helped promote well-considered decisions. If you frequently visited websites, it could promote impulse buying, and there were negative consequences. So just going to websites with dogs helped with impulse buying, and you didn't have that sociocognitive, you didn't have that thoughtful decision-making process, and those dogs ended up relinquished more often. So I know a lot of people have thought, well, that's self-obvious. I've always thought that, but yes, now you have data. The other topic having to do with relinquishment is topic 4, long-term shelter cats relinquished for not using their litter boxes and what happens to them over time. And here's a hint, please don't kill these cats. Time was when I started out in this field that if a cat came into a shelter because it wasn't using its litter box, it was euthanized on the spot because they considered those cats non-adoptable. So this is a 6-year retrospective study of outcomes of surrendered cats with periuria, meaning they don't use their litter boxes, they pee in lots of places, in a no-kill shelter. And all of these cats urinated outside of their box, but here are the reasons that people gave for giving them up. Better chance for placement, what, than putting them on the street? House training, well, we've got that. They're not using their litter box. Owner moving, amusing at best. So what happened to these cats? Well, over 6 years in the shelter where people did things to help the cats and mostly got them out of their home situation, which was stressful. And one of the reasons I'm saying that is they did not get along with another housemate pet. Only 5.4% of people said this, but this is so common in clinical situations. I wonder if people actually understood what was happening in their own household. Because really, sometimes just getting them out of the house makes all the difference. So they had the ability to compare this to cats who were relinquished for non-elimination reasons. And there were 14,000 of those, and 270 of the cats, excuse me, relinquished for elimination. The vast majority of them were adopted, both categories, 95% for the non-urinating, 92% for the urinating. Very few of them were euthanized. And take-home message, these cats are adoptable. And they can do brilliantly in their new homes, and they were not returned to the shelter. And they were not returned to the shelter any more frequently than any other set of cats with any set of diagnoses. Okay, we're into the home stretch here. This is an interesting paper on non-nutritive eating in dogs, and it harkens to asking the right questions. There is a big debate in the behavioral literature about whether dogs who eat non-nutritive substances, plastics, wood, fabric, stuff, are doing it because they have a GI problem, a gastrointestinal problem, or because they have a behavioral disorder. I'm going to tell you right now, this paper comes down on the side of behavioral disorder. Many of these dogs are finally diagnosed, and certainly some of my patients come to me after their 3rd and 4th foreign body surgery, where they've eaten somebody's socks, the socks are taken out of their intestines, and people realize, gee, this seems to be a pattern. Maybe it's not medical. We've been treating it as if it's medical for 3 years and we just keep cutting this dog, maybe we should send it to a behavior specialist. So they've looked at this, and they did a couple of very creative things in this study. They looked at a range of dogs. So they had young dogs, adolescent dogs, adults, and old dogs. And they compared a foreign body group and a control group. So again, another study that compares these to an out group. I love these studies. Okay, and the foreign body group all had surgery. Okay, so they're looking at an extreme group of dogs. They also got history on their early behaviors, and that's going to matter. The things that they ate were primarily fabric, then plastic, few ate rubber, some of them ate stones, some of them ate metal, and one of these dogs ate wood. Okay. And what did they find out? When they went back and they looked at correlations with early behaviors, they basically found out that most of the dogs, remember, most of them were eating fabric. 54.8% were eating fabric. The vast majority of the dogs who engaged in foreign body ingestion to the point where they needed surgery, which is all they looked at in this study, they only looked at the severe ones, ingested or regularly shredded non-edible objects as youngsters. And that should be a bottom line history question at every single veterinary visit. And if they are chewing up and shredding non-nutritive things as a baby, they may be at risk later in life. And if they are doing it more and more as they get older, screen them for this and send them to a veterinary behaviorist. Finally, our very last topic is about a paper that makes me laugh every time I read it. And the question is, do black dogs get hotter? Now, I think all of us say things like, I live in the desert, so I drive a white car. It reflects the heat better. Or, you know, we see people in desert environments and they're wearing loose, light colored garments most of the time. We talk about, you know, we know a lot about what absorbs heat. Black surfaces absorb heat, light surfaces reflect it. There's a whole biophysical ecology literature out there that says that. Well, an awful lot of our working dogs are Labrador retrievers, and they work in very, very, very hot climates and dry climates when they're explosive detection dogs. So the question becomes, black or yellow? Do they run hotter? So you can take a vote, but this is a beautifully designed study. And they had 3 phases. So every single dog, regardless of color, rested in a climate-controlled crate for 30 minutes. Then they had their temperature taken. Temperature was taken 3 ways. They had a thermometer, a rectal temperature thermometer. They were fed thermistors, so they swallowed a thermometer that dumped to a data logger. And an IR gun was pointed at them, so you got the infrared temperature of their coats. So they sat in a climate-controlled area in a crate for 30 minutes. Then they were walked outdoors for 30 minutes. And this is in mid-North America, where it can get extraordinarily hot in the summer. And these were largely service and search and rescue dogs in this study. Then they had their temperatures measured. And then they were allowed to cool in a crate in the same climate controlled area that they'd been in initially for 15 minutes, and then their temperatures were measured. Okay. They didn't have to feed them another thermistor. This is only a couple of hours. They tend to be defecated out the next day. We underuse these in veterinary medicine, and they're used in research all the time. And I just wish we used them bought in bulk. They're very cheap. So to give you an idea of some of the things you can do if you have thermal imaging and infrared cameras, here's a dog. This dog is black, and he's just sitting there. And you can see the red areas where he's hot. And here he is after walking in the sunlight. Notice that almost all of him is hot now. You can see that even his back is hot. You'd expect his legs and his belly to be hot, but his head is spread, his tongue is hot, the only place he can do evaporative cooling besides the pads of his feet, and his back is hot. So when you looked at coat color for rectal temperatures versus the thermistor that they swallowed, there is no difference between the black dogs, which are black here, and the yellow dogs, which are yellow, for any of these groups, the baseline, the sunlight, the cooling. Thermistor, baseline, sunlight, cooling, no bloody difference. Oh, there's a big difference. If you're walking in the sun, everybody gets hot. Okay. If you look at using an IR gun for abdominal thermal imaging or IR photography and thermal eye temperatures with an eye gun, and thermal eye temperatures are used as a measure of stress. It's widely used in horses now because if you're stressed, there's increased blood flow to parts of your brain and your orbit, your ocular orbit. And sure enough, there are some differences, but not significantly. So no difference between black and yellow, black and yellow, black and yellow. Of course, when you're in the sun, there is a difference of phase here. When you looked at respiration, so one of the things you could say is, oh, but black dogs are just more effective panters. No, they're not. Black dog, yellow dog, black dog, yellow dog, black dog, yellow dog. No significant differences. Okay, look at the error bars. They completely overlap. Of course, being in the sunlight, you have more. And then maybe black dogs just are better drinkers than everybody else. Nope, they're not. Okay, there is no effect of coat color on drinking, and there is no effect of sex on drinking. The bottom line is, it doesn't matter what color you are. And I know very few people who would have predicted that result. So sometimes there is just some unbelievably cool science that pops out. If you need to reach me, here's my email address. I do occasionally tweet. My website has a ton of handouts on it, and we're adding more. And I'm going to get the web guru to add the stuff that we asked for the first couple of webinars. If you need a behavioral appointment, we do in-person and distance consults. You email us at ABC Behavioral Med, and there is a U because it's in Canada, at upi.ca. If you want to look at what we do in clinics, bios, cost forms, clinical information forms, and history forms, they're all online at the Animal Welfare Center, the behavioral medicine section of it. And the Journal of Veterinary Behavior is the journal I edit. Some of these papers came from there, but I took papers from all over the place. And I really hope you enjoyed this tour through the literature, which tells you just a little bit about some of the things that are ongoing and hot and cool and interesting. And in terms of medications and outcomes, actually important. And how can there possibly be no questions? Oh, Q&A. A common recommendation before vet visits, trazodone, gabapentin, or the chill protocol. Is this still a good combination to use, or would alprazolam be a better choice? I think this is a common chill protocol. I get that. I think it hasn't been evaluated to the extent that it should be, and we don't have the comparison studies. We do extremely well with gabapentin and or alprazolam and or them combined, and we have combined them and you can do that, and or Cilio and either gabapentin or alprazolam combined, and we don't get sedation. The problem with the trazodone is at the dosage levels we are using with trazodone, it is not an anti-anxiety agent. You're relying on the sedative and movement components. You need 50 to 100 times the dose to get to kick in the receptors that are affected in an anti-anxiety way in humans. We don't know what dose you need in dogs, but it's going to be much higher. And we're already having sedative effects at a non-anti-anxiety, but a hypnotic dose. So I try to stay away from trazodone in these situations if there are other options. And I think we're going to see more and more of that. I look forward to combination studies, and I look forward to comparison papers. There is a paper that just came out in the Canadian Veterinary Journal written by 4 of my vet students with me coaching them. And it just came out, and it looks at pre-visit medications. So that's available for people. What types of behavioral conditions do you see from pica and anxiety issues? The big thing that we worry about, not all pica is the global term for the ingestion of non-nutritive substances. Not all pica is obsessive compulsive disorder, but some of it actually meets that criteria. So the conditions we can see this in, and you can see this in generalized anxiety disorder. Some dogs will do this. You can see it in separation anxiety disorder. Some dogs have situational anxiety where their response to that is some form of pica or barbering. Barbering didn't show up in this, but there you're ingesting fur, and generally your own. So a lot of people don't ask those questions, but they should. Certainly our big rule out by the time it comes to a specialist is OCD. And I have to tell you that by the time it's being referred by a surgeon, the vast majority of these cases are true obsessive compulsive disorder. And these individuals are obsessively seeking out things in their class of objects to eat. And oddly enough, this is a place where I would put a muzzle on a dog, because it's one of the ways that we can stop them from ingesting things. We also are using more frequently for these dogs until we can get them to respond to meds. And some of them never respond sufficiently adequately to meds that the clients feel comfortable for taking off their device that prohibits them from ingesting this stuff, is we're using some more of these mesh head covers. Because if they're wearing one of these mesh head covers, not only do they not have flies and mosquitoes bothering them, but they can't pick up something through the mesh, and it's nice and light and airy, and they don't move in any ways that are distressing to them or to their humans. So that gives you an idea of some of the things that can happen. So it's been a banner year for papers. And again, one of the reasons we do this session is because I realize not all veterinarians have the time to read the literature. Many of the journals, one of the reasons I concentrate on our journal, I have access to any journal in the world, is simply that ours is so bloody expensive for veterinarians that nobody's going to be getting it. So I want to give you some ideas. And the open access journals like Veterinary Record, where a couple of these papers came from, people may not know they're open access. And that means you can just Google them. The article will come up. You can read it at your leisure if you have the time. So part of this is time saving, part of it's because of access. Hannah asked, do you have any guidance on starting a behavioral assessment questionnaire for an owner unwilling to do a referral? They have a golden who eats rocks, just had her 3rd foreign body surgery, and has been managing to get rocks through the Baskerville muzzle. Yeah, she needs one of those lovely mesh things over her head. And what I would do is, our questionnaires are online at the Sir James Dunn Animal Welfare site. The penultimate section of that is the OCD questionnaire. She pops up positive, and she will. She needs help. This dog is going to die because of this. Okay, at some point there won't be enough of her guts left to sew back together. And the dog is not having a great life. And when she looks at the pattern in that questionnaire, I think she would perhaps change her mind. And I think that's a good place to start. You can also go to my website and you can look at the protocol for OCD, which is freely available there. And that may also help you. Oh, hi, Elizabeth. Are there any muzzles that are properly fit flat-faced dogs? Flat-faced dogs are everybody's nightmare. The cruise muzzles do the best job I've seen. but you've got a heck of a lot of leftover muzzle if you fitted them correctly. If they have to wear a muzzle to get on public transportation, you're stuck. That's what you've got. And they can't wear a tight one, or as you well know, they obstruct. If they're wearing it for these purposes, OCD, nutritive, pica, ingestive purposes, they can certainly wear one of the little mesh caps. And if they're wearing it because it's aggressive, these black dog head collars can fit. We fit them on some pretty flat-faced dogs. If they're absolutely flat, again, you're in trouble. And now we're back to, why are we breeding dogs that can't breathe, that can't swallow, that can't exert any exercise without beginning to choke, and where we can't get anything around their necks, and that may not be able to have babies without a C-section. We shouldn't be breeding those. But the dog in front of us needs our help, and he didn't ask for any of that stuff. So those are the things I'd suggest. Juanita asked about common caps. Any risk to eating this? Yes. If they can, now a common cap doesn't fit everything, but it may stop them from seeing the things they want to eat. If it's well fitted and they are wearing a collar and it's fitted to the collar, most of these dogs can't get it off. I would watch like a bloody hawk if they like fabric. You would be surprised at what some of these dogs can do. Okay. Looks like we're done.